The problem with cognitive rehabilitation is it's so complex that it's sometimes hard to deal with all the moving pieces in terms of not just assessing, but really bringing the client and family into the process, providing education, receiving information, partnering with the client and the family in terms of goal setting. There's all sorts of moving pieces in there, and I think it's sometimes helpful to have a framework that allows you greater consistency in how you deliver treatment. I think in some ways it mirrors what we do with some of the folks that we work with brain injury, and where we provide structure for them to more reliably remember the things they need to do to get through the day. And so I think this structure is that can be applied to cognitive rehabilitation eases the burden on the clinician, while still remaining flexible to provide cognitive rehabilitation to a number of different types of clients.
I agree with the assessment that this field's complex. It requires you to be a neuroscientist type person and a psychologist type person and a behaviorist and a really good counselor. So what we need to provide functional cognitive rehabilitation is really a framework, and in the course we provide a description of 6 distinct principles that guide functional rehabilitation. We talk about 4 distinct stages in the cognitive rehabilitation process, and we describe 6 specific cognitive rehabilitation approaches. And of course all of these interact, and I think having a framework like that might be useful to clinicians in trying to address the complexity that they're confronted with this population.
There's a part where we really talk about assistive technology for cognition and how people can begin to use apps, just simple everyday apps that can be applied to people with brain injury, in which they select apps based on the features that align with their specific cognitive profile to let them and support them in doing valued everyday activities. So this is an approach that I don't think has gotten a lot of press. It's surprisingly absent in the cognitive rehabilitation literature in terms of how to select apps on the basis of features that support cognition, and maybe very low-hanging fruit that is available to clinicians, as most people are now attending therapy with smartphones. And this is very easy to do.
Yes, I'm excited for the group to hear some of what Don's presenting on the apps. We also are describing specific method and examples, including case studies for training cognitive strategies. And I think an important takeaway that people will get is to become better consumers and deliverers of direct cognitive training, and kind of thinking about the variables that are important when deciding to do the type of intervention that involves more drill-oriented work. So I think some specifics about implementation across common cognitive rehabilitation areas will be areas that people will be happy to have information about. I think it's easy to talk about person-centered therapy and person-centered rehabilitation, but the implementation is tricky. So our hope is that we offer some specific action items and provide some skill training in that arena. And I would just add that it's not only provides more effective, efficacious therapy, but it's also more satisfying as a practitioner to have that collaborative relationship with your patients.
I agree, yes, very much so.